So before we look at a status neutral system, let's first talk about how our current system works. While we often refer to our system as being client-centered, in practice, it's more disease-centered. In order to get access to our systems, a client's HIV status must be known, and most often, they enter solely through combination prevention services, like HIV testing. Once a client's HIV status is known, then we can start connecting them to other services, including meeting basic needs like housing and food assistance, which are often our clients' priorities. Even then, the majority of these services can only be accessed by people who are living with HIV. People who have increased vulnerabilities to acquiring HIV and may be trying to access PrEP or other prevention services often don't have access to these basic needs. This is a disease-centered system. So now let's take a look at how a status neutral framework changes how a client moves through the system. First, we think about centering our priority populations and what their true needs and priorities are. Instead of only offering access to our agencies through HIV testing, instead we can bring clients in through the services they have the most pressing needs for, like housing, and can begin our engagement with them by respecting their priorities. During this encounter, we also want to start understanding the client as a whole person and what their other needs are, as well as continuing to establish a relationship with the client and build rapport. This is important so that we can offer the client the support they need to maintain their health. As needs are identified, we start providing education about resources and making referrals as necessary. Also, as part of these engagements, we do want to provide HIV testing services when the client is ready, and based on those results can engage the client in the HIV prevention or care continuum. Even in the prevention and care continuum, the steps look pretty similar regardless of HIV status. They'll get their test results, get screened for combination prevention and HIV care services as appropriate. Following that, those who are ready and willing will get an ART prescription, PrEP or PEP for folks who test negative, HIV treatment for folks who test positive. Our goal for HIV treatment is viral suppression, and our goal for folks on PrEP or PEP is to stay on that treatment as appropriate. Then maintenance and ongoing support and ongoing access to supportive services as needed. Finally, even though our goal is for clients to maintain adherence to HIV prevention and treatment, not everyone's pathway is linear. System and environmental challenges may make it difficult for folks to stay in our prevention or care continuum. And even if the folks disengage from these continuums, they should still be able to access these basic needs. For example, providing safe and stable housing on its own is HIV prevention and will have an overall positive impact on a person's health, regardless of status. This is a status neutral system, and this is truly client-centered.